In just the last month, mHealth Fairview's Bethesda hospital has transformed to take an influx of COVID-19 patients in. They've been specializing in critical care, seeing the sickest of sickest patients. I spoke with the nurse who's been giving us updates. Here's what she had to say after getting off her latest shift early this morning. Emily, thank you for joining us once again. And I know you just got off of a shift. How are you holding up now that we're a few weeks in?
It kind of depends on the day. We have some really good days there, and we have some really hard days there as well. So last night was a good day. We've seen a handful of our patients actually get better and be able to move off of the ICU unit that I work on, which is just amazing. You know, words can't describe. When these people come in, they are so sick, and seeing them get better is a miracle.
That's so good that they're recovering. And you said when they first come in, it's bad if they make it to that point. What are the kind of symptoms, things that's happening with their bodies?
So, you know, a lot of times what we're finding, and there's new articles, new facts that they're finding out every day, but a lot of times it just kind of sets these people into a respiratory failure. That seems to be the main symptom, and then they need to be on the ventilator, and that's why they end up in the ICU with me. But we've heard like a wide variety of things from, you know, people having GI issues, people having fevers or coughs. You know, we've heard lots and lots of different symptoms that start out, but kind of a late sign, like we like to call it, is the respiratory failure. And that's when the virus has gotten so bad that they aren't able to breathe on their own.
Well, give us the update on equipment. How is it right now? What's the status?
We're starting to really see things get low, and I know that obviously this isn't just a Minnesota issue, this is a nationwide issue, and it continues to be. But, you know, the main thing that we're starting to get short on now is our gowns. So we're being very careful on how we use the gowns. You know, we're trying to limit the number of people that are going into the rooms like we always have been, so that we can conserve our protective equipment that way. We're still using our masks for multiple shifts as long as they're not soiled or torn, but we definitely are starting to see supplies go down.
Well, tell me right now, everyone sort of at this point of we don't know when this is going to end. What is your hope, or do you see any hope right now, being on the front line?
Like I said, you know, hope for me is going in and seeing these people get better, whether that be, you know, medications that they're on high doses of, we're starting to come down on them, or, you know, in the extreme cases, which like I said, we're so excited about, seeing people actually get off the ventilator and walk. We saw a man walk off of our unit, which, I mean, I'm getting goosebumps just telling you about it right now. You know, it's really day by day. For a while last week, our census was kind of on the lower side, and then the next day that I came back, we had 3 or 4 admissions. So I don't think anybody knows, and, you know, I'd love to tell you we have a crystal ball, but it's really day by day.
Well, thank you so much, Emily, for doing the work you do. We appreciate you.
Thank you guys so much for letting me chat again. I hope everybody has a happy Easter.
Thank you. Happy Easter.